Welcome back. South Africans are fretting about the possibility of a more stringent lockdown once more. The second wave of COVID-19 infections has been worse than expected. And on Christmas Day, South Africa announced a new daily record. In a single day, 14,796 new cases were recorded. So that's sort of heading to 15,000. Hospitals are filling up. We reported on that earlier. The health minister has said recently that new regulations may be required. Well, the soaring infections have been linked to a new variant of the COVID-19 virus that is prevalent in South Africa. You'll recall the UK has banned travellers from South Africa, but we have tried to push back, saying there is no evidence that South Africa's variant is worse than the UK's. Let's look at the situation now by looking at the numbers and graphs supplied by senior researcher at the CSIR, Dr. Ridhwaan Suliman. Dr. Suliman joining us now. Thank you so much, Doctor. So let's start with your first graph, the average daily COVID-19 cases per week in South Africa. On Christmas Day, we looked at that biggest single number in a 24-hour period, nearly 15,000, but you're looking at the averages. So just tell us what you're seeing, comparing the second wave to the first wave, which we'll see kind of in the middle of the screen in purple.
Good evening, Francis. Thank you for having me. This week we've seen record number of daily cases, 3 consecutive days of over 14,000 new cases. Currently, if we look at the 7-day average, we're averaging just over 11,700 new cases per day. And concerningly, if you look at the increase week on week, this past week has increased by just about 50%, and that has been the case for the past few weeks. In other words, we're looking at a doubling rate of new cases just about every 2 weeks or 14 and a half days. So this rapid rise is concerning. We'll most likely pass the 1 million mark case in the cumulative confirmed cases later this evening. And at last, 100,000 cases coming in just the past 9 days. So again, the rise is quite rapid. But what does it mean? Well, firstly, because of our high test positivity rates, the actual number of confirmed cases is not a true reflection because there are many undetected cases. The true number of cases is a lot higher. More concerningly, the rate of increase, this doubling rate or percentage increase from previous weeks is quite high. What that means is if we're reporting 100,000 new cases in 9 days, fortunately, many of those may be mild symptoms, but unfortunately, about 10% of those also may require hospitalization. So do we have the capacity to be able to keep up with that rate of increase?
Yeah, the whole point was getting hospitals ready. Just looking at that graph, let's remain on it. Can we say that the second wave will surpass the peak of the first wave pretty quickly in coming days?
Well, if you just look at the numbers, we currently, as I said, surpassed the record number of daily cases, and that's just while the infection has been surging in the Eastern Cape and now in the Western Cape. But it's only starting to increase in KwaZulu-Natal and Gauteng, the 2 most populous provinces. So in all likelihood, we will surpass what the levels that we saw at the peak of the first wave.
Yeah, and like you say, it's happened so quickly this time with the second wave, much worse than expected, and we could pass 1 million, sure. So let's look at the daily incidence rate per province now. Break it down by province. Can we at least take heart when we bring up this graph that you'll see that in the Eastern Cape, it seems that the rate is coming down, and in the Western Cape, that blue line there seems to be turning at the top. Is there any good news there?
Yes, that's indeed quite correct, Francis. The good news is that the Eastern Cape has shown a sustained decrease for a number of days now. So we can quite confidently say that Eastern Cape has passed the peak of the second wave, and we can confirm that with other measures, which we can look at as well. The Western Cape, as you indicated, is starting to show a slowdown in the number of confirmed cases. It's difficult to read too much just yet, and I think we need to give it a bit more time. However, the rate of increase in the Western Cape has certainly slowed down as compared to the previous weeks. Interestingly, if you look at the Eastern Cape, the number of days that it took from a sustained increase to its peak was about 70 days, and the Western Cape has been increasing for about 67 days or so. So maybe there's something there, about a similar time to increase towards its peak. The bad news to point out from this particular graph is that the numbers in KwaZulu-Natal and Gauteng, the two most populous provinces, are now increasing really quickly, showing 70% increase from the previous week, or a doubling time of 9 days. And that's something to look out for as we go forward.
Yeah. And getting to the real picture, you raised a concern earlier, and let's bring up a graph around the average daily test positivity rates. So there's huge concern about the percentage of people who are being tested that actually test positive. Run us through the graph about positivity rates and tell us why that is so important.
So the test positivity rate is essentially the number of new cases as a percentage of new tests conducted. The graph shows that the current 7-day average is about 26% and an increase of almost 30% from the previous week. What that number means is that for every 3 to 4 tests that we're currently conducting, we're confirming a positive case, which is really concerning. It means we're not testing widely enough, or we don't have the capacity to keep up with the scale of the outbreak. But it also means that there are a number of undetected cases, and so the actual number of cases is a lot higher than what we're currently recording.
But presumably we don't know how much higher, double, triple, we have no idea.
Well, we can guess. We don't have a complete idea, but we can guess it's likely 4 to 5 times higher than what we're currently seeing.
Sure. Test positivity rates per province, break it down by province. What are the trends there?
So we see a very similar trend in the test positivity rate per province as we saw in the incidence rate or the cases per province. There's a slowdown or decrease in the Eastern Cape, which is good news, and which confirms the decrease that we see in cases. The test positivity rates in Western Cape and KwaZulu-Natal are very high, surpassing the levels that those provinces saw in the first wave. And it's also increasing in all other provinces too. Of course, because we have testing capacity constraints and we have now introduced testing criteria in certain areas, it is understood that the test positivity rate will increase. The concern, though, is that, like we said, we don't know how many cases there actually are, and we don't actually know how widespread the infection is, and that's what the test positivity rate is concerningly indicating.
So then on the ground, I mean, the big concern is hospitalizations, and we've been hearing from the medical fraternity just saying they're under incredible pressure. Let's look at new COVID-19 hospital admissions per week in South Africa. What are you seeing in the numbers right now?
So if you look on a national level, the number of new hospital admissions over the previous week was just over 7,600, and that's increased by about 30% as compared to the previous week. This increase is driven by an increase in the Western Cape, as well as in KwaZulu-Natal and Gauteng recently. The Eastern Cape, which was increasing for about 10 weeks, is starting to show a slowdown in new hospital admissions. But the concern is that the Western Cape has exceeded levels seen in the first wave, and KwaZulu-Natal increasing quite rapidly, as well as Gauteng. Yes. Both of those increasing in excess of 50% compared to the previous week.
And I mean, is it fair enough to say, in terms of hospitalization, like you say, the Western Cape already worse than the first wave, so even the hospitals that got through clear the first wave or just managed to cope, there's a chance that in coming days they could be overwhelmed. It could be worse than the first wave.
Indeed, that is the concern. We do know that hospital admissions or hospitalizations do lag the cases by about 2 weeks. And so the cases which were still rising up until now indicates that the hospital admissions will continue to rise for at least the next 2 weeks. And we need to prepare our hospitals as well as support the staff and nurses, doctors to be able to get over this particular wave.
Yeah. All right, let's bring up now perhaps the most telling graph and the most worrying, the death rate. And sure, you'll see it's already looking worse than the first wave, Dr. Suliman.
Indeed, this is quite concerning. We're currently averaging about 283 new deaths per day, and that's the average over the past week. It's just about surpassed the levels that we saw at the peak of the first wave. And the new deaths are mostly driven by new deaths being reported in the Eastern Cape and the Western Cape, and now also increasing in other provinces too. It's difficult to say from this particular graph whether the second wave is indeed worse or more people are succumbing to the virus, of course, because there are nuances and limitations to the data. And the limitation here is that this is relying on data that's being reported. So perhaps in the peak of the first wave, we weren't reporting all COVID-19 related deaths, or they weren't being reported timelessly. But it does indicate that the number of deaths are certainly increasing, and also increasing quite rapidly here.
Does this graph suggest anything about this new variant of COVID-19 that's a big concern in South Africa?
As I said, I think it's a bit too difficult to say just yet because of the limitations in the way we collect the death data. It could be that during the first wave, death numbers weren't reported timelessly, or we weren't picking up all of the COVID-19 related deaths, and we may be picking up more during this wave. So we need to bear that in mind before making any of those conclusions just yet. Yeah. We can also look at another indicator, that being excess deaths. Although they don't tell us exactly what number of deaths are COVID-19 specific, they do indicate the burden of the pandemic, and that could also give us another indicator as to the true burden of this pandemic.
Yeah. Even looking at excess deaths, some believe that our death rate, I mean, any death is too many, but compared to some countries, for example, what was seen in Italy during the first wave, some said South Africa's death rate looked quite exceptional. Do you think relatively, in terms of data around the world, we're still an exception or not?
So thus far, I think our mortality rate has been lower than the average. And there's been a number of reasons speculating why this is so. One of them could be our younger median population age, could be certain prior levels of immunity, but it could also be that we weren't really reporting all of the COVID-19 related deaths as accurately, and we need to also look at the excess deaths to try and look into that further. But you're right, thus far, I think on average we were showing relatively lower mortality rates as compared to global averages.
Yeah. Let's look at daily COVID-19 deaths per province finally. If you look at the deaths per province, Dr. Suliman, why is the Eastern Cape going up when their infection rate is coming down? That's the green line on the graph.
That's a good question, Francis. The daily number of deaths in the Eastern Cape is still rising, and rising above the levels that were reported at the peak of the first wave. We do know that the death numbers do lag the case numbers. So while cases have peaked and are starting to show a decrease, the death numbers are essentially locked in for 4 weeks thereafter, and so we need to wait for that period before we start to see the effect on the death numbers.
All right, thank you so much for your analysis tonight. Whatever graph you look at, and thank you for providing those very illuminating graphs, it looks like South Africa is in a very worrying situation indeed. That was CSIR Senior Researcher Dr. Ridhwaan Suliman.